Everyone's talking about peptides and GLP-1s, but what actually are they? Are they tools? Are they a shortcut? Are they hype? I don't know. Or maybe it's really something in between.
Today we are going to break down what's real, what's safe, and what women need to understand, especially as we age. No judgment here. We're just going to give you guys the facts. You can do what you will with them.
See you on the show.
It's a beautiful chaos, this roller coaster ride. The ups, the downs are spinning all around inside. It's a beautiful chaos. Sometimes I love, sometimes I hate. Have to pause, renegotiate, but with gratitude I appreciate this beautiful chaos.
Welcome to Beautiful Chaos. I'm Tammy Ramsey,
And I'm Stacy Miller.
and today's episode is on peptides and GLP-1s. And we have a guest today.
Yes, an expert even, so that we don't accidentally talk outside of our expertise. So joining us today is going to be Dr. LeeAnn Bolgen.
She's actually a family nurse practitioner. She's passionate about health and wellness and helping patients to fulfill their highest potential mentally and physically.
Wonderful.
I know, she's got her hands full with me.
She,
Right? She works at the Power County Family Clinic. She's a board of Patient Quality Alliance and the COO of IntelliHub. So that's a new and upcoming online service that she is the CEO of.
Nice.
So, anyways, she's been working in healthcare for over 20 years. She holds certificates in hormone therapy, peptide therapy,
Perfect.
expert, and anti-aging longevity medicine. Even though she does prescribe medications for her patients, she always tries to help them to adjust their lifestyles and avoid them. And I can attest to that for sure. So, when LeeAnn is not working, she enjoys being with her family and doing outdoor activities in beautiful southeast Idaho. And it sure has been beautiful these last,
Yeah.
in December anyways, it was beautiful.
Yeah.
So welcome, LeeAnn Bolgen. We're super excited for you to be here with us today. We want to talk to you about and have you kind of explain to us about peptides and GLP-1. And to my understanding, GLP stands for glucagon-like peptides, and we create glucagon peptides within our guts. Is that correct?
Yes, yes, that is
Okay.
correct. It's basically a peptide or a hormone that helps when we eat food. It helps stimulate insulin and suppresses glucagon production. It reduces your appetite and makes you feel kind of full, slows the gastric movement and slows that emptying. So it's a great peptide, and it's used frequently. They've actually, people think that they're new, but they've been around for probably 20, 30 years. It's just that they have found an effect among all the GLP-1s that weight loss is a class effect. And so recently, in the last few years, they've become very popular for that reason.
Well, so when you talk about it being something that was back in 20, 30 years ago, was it utilized to help with diabetes or pre-diabetes?
Yep.
That's what it originally
It was utilized for diabetes, yes. And the way that it works, people think when they think about peptides that it's like, they had phentermine and that would help with weight loss by increasing the metabolism. And, there's these different, magical theories on it's increasing your metabolism, it causes fat loss. But really, in essence, what the GLP-1s do is you are not wanting to eat as much food. And if you eat foods that are high in carbs, high in grease, high in sugar, you're going to be sick. So it kind of positively reinforces good behavior and negatively affects those behaviors that cause weight gain. And so it's actually a great way to help change behaviors.
So that's one thing that I want to talk about too, is that I think that, and especially where where your focus is in the clinic, as far as you want to try to help people in all natural ways, and then if that doesn't work, then you help them with medication. So, I mean, I feel like that diet is very important. What we're putting in our bodies is very important, and we should probably balance out what we're eating when if we're using a GLP-1, then we should be focusing on changing the way that we're eating and creating healthier habits. Is that
Absolutely.
accurate?
So I have to say, I am an easy sell to prescribe a GLP-1 because I feel like, and it's not that I feel like, I know that the Food and Drug Administration in the US does not regulate the types of chemicals and substances that are very addictive in our foods. And so, in fact, a couple of years ago, I attended a digital worldwide conference, and it had all the leadership health people for all the first world countries on this in this conference, and they were all discussing what they were going to do about the obesity epidemics that are occurring in these other first world countries. And they're occurring because a lot of these countries are adopting our same foods that we have in the US and our same habits. And as a consequence, their healthcare is getting more expensive because obesity rates are going up. And a lot of these other countries, if you've gone to the UK or some of these other countries, they don't have the same food on the shelves that we have. It's outlawed. But we don't outlaw a lot of those things. We allow it on our shelves, and they have these chemicals. In fact, there's a book out there. It's called The Dorito Effect, and I'd recommend anybody read it. And it just tells about how, starting about the 1950s, 1960s, they started really targeting the addictive center of the brain, which is where that dopamine release comes from. And if you think about it, with people who are, struggling with obesity, these are very highly functional, motivated people. They hold jobs, they're doctors, they're lawyers, they're very productive wives and mothers and all sorts of jobs. They are not obese because they are lazy and have no self-control. Oftentimes, it's because we have these highly processed, ultra processed foods that scientists have gone in, and they actually will do MRIs on people, on their brain while they're eating this food, to find which chemicals and which substances can we put in the food to make the brain light up in the highest areas with dopamine, because those are the types that then they get the repeat customers. They're going to continue to buy their foods. They're going to continue. And so really, I'm a cheap sell with the GLP-1s because I feel like it's an unfair environment in the US today, because the foods that are most often available are the ones that have the highest addictive ability. And so just like sometimes, if people have an addiction to cigarettes, to alcohol, oftentimes you'll need something to help you cut that addiction. Food is the same way. And the way the GLP-1s work is they not only do they, slow or reduce that appetite and make you feel full, but they also affect that craving center in the brain, which gives you a little more of a fighting chance to come off of those highly processed, highly addictive foods. The issue is whenever you start on these medications, you need to make it up in your mind that you're going to change your habits. Because if you just use the medication to eat less, but you eat still processed food that's addictive, as soon as you go off the medication, guess what? You're going to gain everything back. However, if you go on the medication and you decide that you're going to eat a clean diet, clean meaning nothing processed, no sugar, I would actually eliminate processed flour as well. Then all of a sudden, you are allowing your brain to regulate and balance itself, balance those dopamine receptors, cut those cravings, and heal naturally, to where after, 3 to 6 months, you get off of the medication, you already have established a healthy habit, healthy lifestyle, and you keep the weight off. Does that make sense?
Absolutely. I have a question. I'm kind of going back to the beginning here, but when we talked about how GLPs were first prescribed to people who had diabetes for their insulin resistance, if you have somebody who is using a GLP-1 for weight loss and doesn't necessarily have an insulin resistance issue, what is that GLP doing with them when it comes to like processing insulin? Is it having any negative effect in that way?
No, no. Actually, the GLP-1s are great because they will not, unlike insulin, it is not something that will make you go hypoglycemic.
Mhm.
Now, if you don't eat, then you will go hypoglycemic, but that's a natural effect, right? And that's actually, people are concerned about having hypoglycemia. That is actually very rare. Humans can go a couple days without eating any food at all. I mean, honestly, we usually, unless you have no, body fat or no reserve, generally that's really not an issue. For a small
Right.
part of the population, it is. In fact, I often recommend to people, even if they don't have diabetes, get a continuous blood glucose monitor and watch your sugars because it actually helps to reinforce good behaviors and help you to stop bad behaviors. Because if you eat a piece of cake, your body doesn't scream to you and say, "Hey, my glucose just jumped up to 200," right? It's more like, "That cake tasted really good. Is anybody watching? Can I have another piece?"
Right.
So, but if you get an alarm that says, this is what this is doing to your body, all of a sudden that cake looks a little more like poison.
Sure. Yeah.
So, yeah, no, I really, so there are some populations of people that should avoid GLP-1s. Anyone with a history of thyroid cancer should stay off of them. Also, if you have already problems with something called gastroparesis or slow gastric emptying, you want to stay off of them. But really, there's very few people that should steer clear of these. There hasn't been any real research that I can see that where it should be implemented in kids for any other reason than diabetes, like adolescents. I know it's a fine line, but I'm always very cautious to advise any medication use in anyone under the age of 18 unless I have some good research to support it. I imagine that's coming, but as of right now, yeah, anyone 18 and older that is struggling with, because if you think about it, generally these are given for obesity just because someone has an A1C of maybe 5.2. So 5.7 is an A1C where you start diabetes. 6.5 is where it's officially diabetes. And we're a little backwards in thinking, okay, we will not give this medication until they climb up to that. Well, if you're trending the A1C and it's kind of trending up, 5.2 one year, the next year 5.4, the next year 5.6, and they're gaining weight, prevention is key. Obviously,
Right.
they're having more insulin than they need to be, and if you have a high amount of insulin, that causes insulin resistance, and then you get diabetes. So it's like, get on the horse before it becomes a problem.
Right. And then is there one that you recommend over others when it comes to like a semaglutide, tirzepatide, or
You know what? It just depends on the person. Some people do better with one versus the other. I find I like tirzepatide better because it's a GLP-1 and a GIP, so it attacks in two different ways. And I say attacks. I don't mean to make it sound like it's anything aggressive. It's not. But in my experience and according to studies, if you're taking it for weight loss, which this time of year, that seems to be the thing that everybody's looking for, that is the one that they find a higher percentage of weight loss with, is the tirzepatide. Semaglutide is also very good. But I do find people have more side effects with semaglutide. And when I say side effects, both medications have the ability to give you abdominal cramping, especially the first couple days after injection. You could have constipation or diarrhea, and some nausea. Oftentimes, like we discussed in the beginning of this, oftentimes that can decrease if you just avoid greasy, high carbohydrate foods. So, and small portions.
Right.
But yeah.
So, what are the biggest risks of being on a GLP?
So first of all, if you're on a lot of different medications, that's an issue. One of the huge risks is if you are going in for a surgery or something where they're going to put you under anesthesia, you'll probably want to hold that for a week or two before you get it done, because again, they're going to be intubating you. If you have that gag reflex and vomit, then it's going to go into your lungs and you want an empty stomach. So that is one of the issues. And then, like I said, thyroid cancer, you want to stay away from it if you have a history of thyroid cancer. But really, the risks are pretty minimal. It's a peptide. They basically, so a peptide, if you think about like the DNA double helix, everyone remembers that module from high school anatomy class.
Right.
Those peptides are all arms that stick out. So it's something that your body makes naturally. You are just doing an equivalent and kind of repairing the one that's there or giving the one that's there a little bit of a boost. So it really, it's very friendly. It's very friendly because it's not something foreign, I guess.
So you talked about one way to be successful if you're using a GLP-1 is that you listen to your body and the triggers that you're getting. And so you're eating more protein, more whole foods, making healthier choices, cutting the sugar, the processed foods, et cetera. And that's clearly a way to be successful long term. And then I've heard some people will like lower their dosage and maybe like micro dose. Is that
Yeah.
a normal thing?
Yeah.
And
Yeah.
then eventually the goal is to be completely off of it and you listening to those same triggers and just keeping that diet that you've implemented. But if you were wanting to find a way to do it without the GLP, is there any way to choose the right foods or supplements or something like that where you can kind of replicate the same actions or the same like GLP?
Yeah. So actually, they do have, and I've seen a lot of infomercials for like GLP agonists, supplements and everything. And I mean, there's a placebo effect that works with just about everything. Try that. It may work, but just the ones from the research that I've done, you have berberine. Berberine is actually, it works a little bit more like metformin, but it does help with decreasing that blood glucose. It helps a little bit with appetite. It's natural. If you're taking metformin, do not take berberine because they are similar.
Right.
Inositol and berberine, the dosage is like 500 milligrams twice a day. You can do up to 1,000 milligrams twice a day, but I would clear that with your doctor first just to make sure there's not any interactions with any medications that you're currently taking. And then inositol is the other one. Now, inositol is another one that helps with blood glucose. It's just you can order on Amazon. It's 1,000 milligrams. You take it about 3 hours before bed. And that will also help with sleep, believe it or not.
Right.
So yeah, kind of a nice effect. So, and then people get a little crazy with their probiotics and prebiotics. These are very important, but I find when you overdo it, you grow yeast, which you don't really want. So,
Right.
so yeah.
This is a little off topic, but what is well, I mean, I don't think PCOS is that off topic when you're talking about insulin resistance issues, but
Oh, yeah.
what is the inositol correlation with PCOS?
Inositol helps PCOS. Inositol helps PCOS because in PCOS, the one of the big issues is insulin. The insulin is so high, your testosterone is high, everything is high. So if you can get that insulin down, you do much better. That's why usually one of the first treatments they'll put somebody on like an oral contraceptive and metformin because they want to drive that insulin down.
Right.
But and honestly, one of the huge problems with PCOS also is grains. Okay, they don't do well with grain diets or processed flour. And so you really want a low inflammatory diet, which would be more just your fruits, vegetables, proteins that are more like legumes, meats and eggs are fine. And then if you do have grains, you want like rice, quinoa, those kind of things.
Right.
But yes, with PCOS, the objective is to decrease the inflammation and decrease the insulin. So decrease the inflammation through the foods that you're eating, making sure that they're clean. That should in turn decrease insulin. But if you need a little more help, of course, metformin is great, but if you're trying to stay away from medication, inositol, berberine, even apple cider vinegar, like 30 milliliters, which is, I think, 2 tablespoons twice a day, will help with that. It will also help with reflux. So,
Oh, that's a good one. I love apple cider vinegar, so that's that's a do easy do for
Yeah.
me. So
Yeah.
what about the theory or myth of loss of muscle mass? So a lot
Oh,
of people are worried about that losing muscle mass. And I could see where if you're shutting off your hunger, that
yeah.
you might
Oh
not be
my
wanting
goodness.
to eat enough.
Tammy, I love that you asked that question because you know what? So many people are saying, "Hey, they put me on Ozempic and I lost my hair and I lost my muscle." And honestly, the thing is if you're in a calorie deficit, you are probably going to have your hair thin. With weight loss, the only way to achieve weight loss is going through a calorie deficit. And your body is very lazy, honestly. It wants to go after the most easy source. And guess what? Unused muscle is an easy source of food. It's much easier to break down than a fat cell. So, with the GLP-1s, I also think it's incredibly important if you're going to go on them. Okay, so diet is the biggest thing. Next thing is exercise. You want to do weight bearing exercise. Everyone should lift weights at least 2 days a week until the day that they die. At the end of life, that weight may be the remote control, but you should be having some sort of weight exercise with weights because if you don't use it, you lose it. And with weight loss, that is the same. So
Yeah.
it's not the GLP-1. It's just the way that weight loss is.
Right. And so eventually, once you get back to just eating the sufficient amount of calories to maintain your weight, then you would write yourself in muscle loss if you were strength training.
Yeah. Yeah.
Yeah,
You shouldn't lose muscle if you're strength training. Your body will not get rid of things that it's using. So
nice.
if you're using something, if you're using those muscles, your body's very smart. Like I said, it's also lazy, but it's very smart. And so if you're using the muscle, it's not going to go to that. It will use the fat.
So another question is there an age limit to like what age should a person not use a GLP because they might worry about dementia, like maybe
Yeah.
60s, 70s, like is there a
And
cutoff?
so one thing with dementia is they're also calling it type 3 diabetes. So really it's very important in all ages to maintain a healthy body weight and just eat healthy foods. I really don't know if I can give you an age just because it depends on the person. It depends on what other comorbidities they have going on. But
Right.
honestly, I've prescribed it to 75-year-olds, but I've also told 60-year-olds that they can't have it. So it just depends on the person, really.
Depends on probably what muscle mass they have, what type of shape they're in
Exactly.
already.
Are they frail or not?
Right.
What's their blood sugars? What do their blood sugars look like? Because like I said, for most of the population, it will not cause hypoglycemia. But if you have a vulnerable, frail little old lady, I'm not sure I'm going to give that to her.
Right. Yeah. She doesn't need to fall over from having a
Exactly.
hypoglycemic moment.
Yeah, exactly. Exactly.
So
So
if you're calling dementia type 3 diabetes, if you had somebody relatively healthy but with a risk of dementia, would you recommend getting that under control, whether it be with a GLP or berberine naturally or something like that to just sort of prevent it?
absolutely. I think if we could, I would be out of a job if we actually changed our system to prevention.
Right.
Unfortunately, we kind of are chasing our tails. But
Yeah.
if even if you don't have a risk of dementia in your family history, I think everyone should shoot for a healthy BMI. A healthy
Hmm.
BMI is considered between 18 and 25. Now, if you have a lot of muscle mass, forget the BMI. Just be healthy, okay?
Right.
And then also, I think everyone should shoot for a healthy blood sugar. So I know, at I work for the Power County Hospital District. We have health fair labs. You can go in once a year and get your A1C. You can also get a fasting CBC or CMP and look and see what is my fasting blood sugar, what's my A1C. You can get an insulin level. These are all things that you can pay cash for. Of course, I'd love to see you at the clinic. One of my colleagues would also love to see you and discuss the results so that you make sure that you understand them correctly. But I think that really we should be monitoring our numbers yearly at least, because prevention is key. And whether you have a history or a family history of these different things or not, that doesn't mean that you are at low risk, or, it really doesn't matter. I mean, because there are other conditions that you want to avoid as well. So I really do recommend daily exercise and clean eating for everybody.
Yes.
And
Amen.
and if you are in a scenario where you're overweight, then I also recommend, or obese, then I recommend getting to a healthy weight. If you've tried diet and exercise alone and it's just not working for you, you're not alone. Come and see us. Let's help you, get taken care of. So
Right. All right. Well, thank you so much for your time. And we'll put up your information as far as the IntelliHub and also the Power County Family Clinic info,
oh,
which
yeah.
everybody around here knows it, but
Yeah. Yeah, absolutely. No, it's I love it. This is probably my favorite topic. And so please let me know if you have any questions, and I'm happy to be on the show. Thank you.
All
Thank
right.
you so much.
Thank you. Glad we could finally get together.
Yes.
Yes, yes.
All right. Take care.
Bye.
Okay,
See ya.
bye.
Bye.